They say a woman's health is her capital, and nourishing herself in a way that helps her blossom in the direction she wants is attainable. Welcome to today's episode of Women Series, where we capture developments and stories that impact women. Today, we'll continue our conversation on women empowerment, but the focus for today is on healthcare, promoting women empowerment through improved healthcare. And joining me to have this conversation is Mrs. Nia Olupono, a clinical instructor at the School of Nursing, Bowen University Teaching Hospital. Thank you for joining us on the program today. It's great to have you join us.
It's my pleasure.
Okay, so let's go right into the conversation. So considering your years of experience as a healthcare worker, what are the major constraints or challenges women face in terms of accessing healthcare?
One of the things that most women, but especially the women in the rural areas will face is accessibility, the access to that healthcare. And if there is no access to healthcare, that means that the family would be affected. So when a family member is sick and they can't take that person to the hospital, the whole family will feel that pain, will feel that lack of healthcare. So that's one point. The second thing is the growth and development of the children. How would a mother bring up her family without knowing what is right for the child or wrong? Because in healthcare, it's not only the treatment, it's also the giving of information to enable mothers use the information for their home.
That's true.
Not only in the care, in the nutrition. Most mothers will get information from hospital on the kind of foods to prepare for different ages of their children, including the adults in the family, whether the adult is sick or well. So if that woman cannot get to a hospital in her lifetime, where would she access this information?
Thank you. So I love the fact that you've spoken about the family in general, because the woman is regarded as the caregiver in a home. And if she cannot access several information or certain information that would help her in taking care of her home, then definitely the home is in lack, the woman is in lack, the home is in lack in general. So with these implications, with these challenges that you have listed, what are the health implications it has on women and the overall productivity of women in our society?
For women specifically, they will not be healthy enough, and so they will lack the stamina they need, the physical stamina and the strength they need to carry out their everyday chores as a woman. Then they would lack that strength to even satisfy their husband. They will lack the strength to be interested in what is going on in their children's life, educationally, academically, or otherwise. Because a lot of the welfare of the home lies on the woman.
We cannot talk about women empowerment when there is a lack in the healthcare system. Now, looking at maternal healthcare, research from the United Nations shows that 1 out of 16 women lose their life due to complications of pregnancy and childbirth in developing countries, actually. So how do you think this can be addressed?
Actually, it's being addressed, but there is a lot of gap. Currently in our country, we have the primary healthcare system. They have been established over years, but there is a gap in those systems. And the reason for the primary healthcare system is so that health can be assessed at the grassroots level. So that means taking health to the people who we think cannot otherwise reach health. But the problems are there in our own particular country. The structures are there, there are barely people who will man the structures and provide the services that those structures are supposed to provide. How can we revive the system and make it work as it was planned to work? The way it's supposed to work is on paper already, but it's not functioning. People don't want to go to the rural areas to work. Any healthcare, nobody wants to go there because there are no amenities, there are no utilities in those communities. And so the government has lost the love they had for their communities to provide all that they need. A lot of the things they have, if it gets to the cities, remain in the city. Nobody thinks about extending it or decentralizing it to the community. So people just play on that and come up with all kinds of services to benefit themselves. So the women are lacking in maternal health. They go to those clinics, but they don't receive what has been proposed for them to receive. So they're still the same.
So I love the fact that you've talked more about the rural areas, because I was going to ask a question on the rural areas. But how about family planning services? How often do women have access to this service in Nigeria?
Yes, as often as the woman wants to.
Also,
one of the components...
The service is available as much as you want it.
Of course. That's the gap I'm talking about. One of the components of the primary health care within any local government area is family planning. So they're there, okay? So, but because it's not functioning, mothers, women cannot get it except they come to the city. Then the second thing about family planning is our culture, our tradition. Right. People still look down on people who want to plan, limit their family. So women are ashamed to go. Number three, we don't have the support of men in family planning. Right. Most of the things that will be used for family planning are female-based. So no woman wants to be seen as having an affair because she's on family planning. And no man will want to be seen as giving approval to the wife to go for any family planning method. So it becomes a secret. Women will not disclose to us or to you that they are on family planning methods. They sneak in and they do it. Their husbands might not even know until the man waits 3 years, she's not pregnant, and it becomes a fight in the home.
So there is a male factor, there is the culture factor, and then I think you mentioned the fact that functionality.
There is a government factor.
There is a government factor.
Let's use that word, yeah, because
all of these things need to be addressed.
Yes.
I think you've spoken extensively about rural areas as well, but in your opinion, what do you think can be done to improve the health facilities and even the services in rural areas? Because I mean, they are the most affected people. People in the cities obviously have access to these healthcare services, but how about the rural areas? What is being done or what can be done to improve it?
Like I said earlier on, the infrastructures are there. Okay. So we need the government to come in and help us renovate those infrastructures. Then bring in light to those kind of, I don't know whether revive those services. People have been trained. Trainings are occurring on a regular basis, you know, but we need to revive them. Improve the condition of service for those who you want to send to the communities. Because some communities will not have electricity, running water might not be available. So there is a lot that the staff or the worker will contend with to be able to make life out of there. I mean, communities enjoy it when they have a healthcare worker living with them. So you are not just looking at what happens at the clinic. You are looking at what happens in the environment you are living with them to help improve it. Okay? So we need the government to help us. I don't know what the government of Nigeria can do today. It's the local government responsibility But you know what it is? They will push us to the state, and the state will push to the federal government,
So
and then they're
between
nowhere.
the states and the local.
Yes, and if something comes into the local government, how would it get to the rural area? Because the local government will want to service the cities first, you know?
So we've spoken about the interventions, in your opinion, that can be done around improving the healthcare service in Nigeria. There is this important trend, or this interesting trend, so to say, around women trying to lose weight. So what are your thoughts around this and the health implications for women? Because everywhere you go now, everyone is trying to lose weight. You see one taking detox tea, another taking this. This is recommending that is recommending this. Let's talk about the health implications for women. What are your thoughts around this weight loss?
Okay, I am a keep fit person.
Yeah.
Okay, so I'm not against losing weight, but your losing weight needs to be meaningful with your lifestyle. Okay, something happened before that woman gained her weight. Yeah. So there's a cultural factor too behind weight loss. Most women, most men would want to be seeing their wives the way they were when they get married. But what we don't factor in is when the woman becomes pregnant, there are changes, the hormones will help her build up. And it's so difficult to lose. So men would want to see women who are in shape. And maybe that's why women are going that trend. It's not that losing weight doesn't have its implication. It does. But how do you go about losing weight? If you watch your diet, if you do your exercises, if you live healthy, your sleep pattern and all that, it's going to help you. At the same time, because you've gained weight as a woman due to changes in your body system, does not mean whatever you do, you have to become less than what you were initially. Even internal organs, after a woman has gone through pregnancy, does not return to its pre-pregnant state. So there will be a slight change. And men should please not push women who are overweight, obese away. We're all in it together. If she didn't have the baby, maybe she wouldn't become that fat. Some disease conditions can make you put on weight. Yes, some family planning, devices too can help you put on weight. So one needs to be well informed so that you are doing it meaningfully and not bringing complications to your body by taking drugs and by doing that. There are simple ways to do it that it wouldn't really affect your health. Rather, it will improve your health.
So I want you to talk about this misconception about detox tea helping to lose weight. Is it true that detox tea helps to lose weight, or is just for detoxification? There is always a misconception about this too. Quite a number of people think when they use detox tea, it basically would help them lose weight automatically. I want you to clear out the misconception about the detox tea helping to lose weight as regards to...
First of all, is that a medication that is prescribed?
That's the thing. Quite a number of women nowadays just jump on detox tea. You see, that's the trend. That's actually the trend. Everyone wants to just take mere detox tea and feel like it's just going to help them burn unnecessary fats in their body.
Well, if you think it's going to burn, somebody must have created that to satisfy our crave. But I know that when such things come, they come in with their complications, which may not be seen immediately. When you go on such drastic weight loss, burning, there will be an excess of skin after you've lost that weight. That becomes another issue. So you need to do surgery so that they take away that excess skin, because you don't want to go around showing flabby skin all over. And for us women, we tend to put on weight on our arms, on our thighs, on our buttocks, on our stomach. So when you go about with those flabbiness, you feel ashamed of yourself, but your intention was to lose weight. So it's better we do weight loss in a meaningful and healthful way. so
So
that we
when you
don't get
mean meaningful and healthy way, what are the meaningful and healthy?
eat right,
Okay.
eat right,
Yeah.
do your exercise. That is enough. Don't live a sedentary life. Get involved, be active, move around, burn that fat by doing that. You know, exercise is a good thing, but how many of us really get into doing it? Yeah, so the toxifications, yes, people think it will remove things in your body. But do you see the fat? You cannot urinate the fat.
Right, right.
It doesn't come out in your urine. It doesn't come out in your sweat. So maybe, and I don't think in our body, from the anatomy I know, that your fat will melt like you have a solidified cooking oil and you put it on fire, on heat, and it just melts away. No. You know, the best way is for you to pass it out in physics. So that means it's detoxification is a cleansing kind of thing, but I don't know how effective it is in cleansing fat.
Okay. Thank you for clearing out that misconception. And finally, what is your counsel to women as to how to stay healthy and productive for themselves, their family, and even the economy at large?
Healthy has a physical part, has a social part, has an emotional part, and has a spiritual part. Those are the 4 components World Health Organization looks at to define health. So we need to be careful of our physical look. Go for your regular checkups. Okay? When you have an appointment, don't think I'm feeling fine and you ignore it. Even before you get an appointment, when you are feeling well, schedule a regular well checkup. You're not sick. We call them well clinics. You know, like what we do for children between the ages of 0 and 5. You take them for immunizations, they check their weight, and they say the child is doing fine. Not only when the child has a fever. So adults can avail themselves for such well clinics. Okay? Think right. Have a good relationship with people, because your emotional status will affect your physical state.
Right.
If you are angry every time on again, you are burning yourself away. Don't get involved in stressful things. And if peradventure you are stressed out on a particular assignment, take time after that assignment to relax and gain yourself. Have a relationship with God. That's the spiritual thing, because He is the only one who can help us live right mentally, socially, and emotionally. The physical is in our hands to do. I know that I should not, at my age, take sugar. So why should I, when I want to have a small cup of tea, I add 4 or 5 cubes of sugar in it? I'm killing myself. I'm killing myself. Now we have COVID. We've been told to protect ourselves. But we disregard those things because we are not thinking right. And we laugh at people who are doing it and say, oh, their own is too much. But that's not it. So our attitude towards such little things we see, little things we call them, we think it doesn't matter, but it matters a lot. So those things will help us. If we are able to do it as an individual level, family level, and believe we can carry it into the national level as well. Be who you are at home, at work, and in the nation.
Thank you very much. I love the fact that you mentioned everyone should stay healthy physically, mentally, socially, and even spiritually. Thank you for coming on the show, on the program today. It was great having you.
Thank you, thank you, thank you.
And that brings us to the end of today's edition of Women's Series. We'd like to hear from you. Drop your questions and comments. You're sure to get a response from us. And also follow us on all our social media platforms and subscribe to our YouTube channel. Visit us on www.ProShareNG.com to get more information on our news stories and videos. Thank you for watching. Please keep staying safe and healthy, and I'll see you in the next episode.